Hey guys, this video is going to be about the deep peroneal nerve. And in this diagram of the anterior view of the leg, a deeply dissected view, it can be seen over here. This is the lateral side and this is the medial side. So the deep peroneal nerve is one of the two terminal branches of the common peroneal nerve. And the common peroneal nerve is basically one of the two terminal branches of the sciatic nerve of the posterior part of the lower limb. So the common peroneal nerve is known to wind around the posterolateral aspect of the fibula, which is the lateral bone of the limb. And on its winding journey, it is known to pierce the peroneus longus muscle, which is a muscle of the lateral compartment of the leg, and deep to this peroneus longus. And we can even see the peroneal nerve in this section, and this over here is the head of the fibula, and the common peroneal nerve is seen to wind around the head from backwards to forwards. And this is the peroneus longus muscle, which has been cut, but if it were not cut, it could be seen that the peroneus longus would be pierced by the common peroneal nerve, and deep to it, you can see it would have been like this, and after having pierced it and deep to it, it divides into a deep and a superficial branch. And the deep branch is known to enter the anterior compartment of the leg, and it does so by piercing the anterior intermuscular septum. So when it's passing in this direction, it pierces the anterior intermuscular septum, right? And in addition to this, it also pierces the fibers of the extensor digitorum longus. So it has a more or less vertical course, and it does so, it travels sort of like alongside the anterior tibial artery, and so has similar relations. So largely it is lateral to the anterior tibial artery in the upper 1/3 and in the lower 1/3, but is said to be anterior to the anterior tibial artery in the middle part of it. Initially in the upper 1/3, and the relation is that it is between two muscles, the tibialis anterior on the medial side and the extensor digitorum longus, this muscle over here, on the lateral side. In the middle 1/3, it is said to be between, again, we have the tibialis anterior muscle on the medial side, and over here we have the extensor, this part, the extensor hallucis longus on the lateral side, and in the lowermost part it is between the extensor digitorum longus and the extensor hallucis longus. And it continues till the midway point between the two malleolus, that is the medial and the lateral, terminates by dividing into a medial and a lateral branch, right? So if we talk about the branches in this section, it gives muscular branches to all of the muscles of the anterior compartment: the tibialis anterior, the extensor digitorum longus, the extensor hallucis longus, the peroneus tertius, which it did not pierce on the way because it was a peroneus longus it was pierced, an important point to remember. In addition to this, articular branches were given to the ankle joint and all of the joints in this area. We even have a cutaneous branch, and that is for the dorsum of the foot and the space, that is the interdigital cleft between the first and the second digit, right? So we also have a cutaneous part of it. We have dealt with the muscular and we have dealt with the articular. And where do these two branches end up? So this over here is the lateral branch, which initially ends basically at a pseudoganglion that is deep to the extensor digitorum brevis, which is another muscle which, although not a part of the anterior compartment of the leg, is supplied by this. So basically the pseudoganglion is located deep to this, but it then leaves the pseudoganglion to supply the extensor digitorum brevis, which it is located deep under, and also the tarsal joints. Whereas the lateral ends by basically, the medial ends by basically becoming part of the cutaneous part that supplies that cleft, as well as all of the other joints in the region. So I'm hoping you got a lot from this. If you did, please like, subscribe, and leave a comment.